So we're going to do attempt number 2. We lost internet. The whole entire state agency lost internet the last time we did this. For those of you who will be joining us that weren't here the first time, I'm Christi Landis with Sooner Start. I'm the Professional Development Specialist.
And I'm Destiny Murray. I'm the Early Childhood Specialist in the Office of Special Education. So children school age from 3 to 5 who receive special services. I am your go-to in the Office of Special Education.
So we will be doing this training in 2 parts. We will be looking at the Sooner Start process and our responsibility for transition, and then Destiny will graciously step up and talk to our Part B counterparts and what that looks like on your end. And so we'll go ahead and get started with our slideshow. And all of our information for those of you who register either on this live site or when you watch it back as a recording, if you register, we'll be able to capture your name and send out the PowerPoint. And we will also be compiling a frequent asked questions list to send out to offer some more technical assistance. So with that being said, let's get started and let's talk about transition from Part C to Part B and talk about our outcomes. What we want our participants to accomplish at the end of this is to really understand what transition looks like from Sooner Start Part B or Part C side into the local education agency Part B, and looking at timelines, who's responsible for what at what time and what that looks like for each entity, and talk a little bit about data and what data is going to look like and what transfers involve, what we can do with transfers, what we can't do, and demonstrate knowledge and respect for each other's team's responsibilities and what their limitations are. And I'd like to start off this session by talking about what is Sooner Start. I know that a lot of y'all work on the Part B side with our resource coordinators so that you're aware of what we are doing. But just giving you a little bit of overview, a little bit of a deeper dive, if you will, to understand what Sooner Start's responsibilities are. We are the early intervention program for the state of Oklahoma. We serve children ages 0, 1, and 2 who are either evaluated and shown at risk or shown as having significant delays, or have a diagnosis that's listed as one of our auto qualifying conditions that would put them at risk for such significant delays throughout their lifetime. We are in all 77 counties of the state of Oklahoma, and we are divided into 8 regions, which have a regional coordinator that supervises all of the ed staff in that section. We also work closely with the Department of Health. We are an interagency collaboration. So our resource coordinators, who are those who reach out to you to make those connections with transition, work for the State Department of Ed, while our people who provide related services such as OT, PT, speech, etc., are employed through the Department of Health. The State Department of Ed is the lead agency as defined by the Early Intervention Act of Oklahoma, and we have a contract with the Department of Health to provide related services. But we do work closely together and have for since the beginning is how it's been and how it will continue to be unless somebody rewrites the law. So some fun, fast facts about Sooner Start. Our organization is voluntary. So that means that if a parent or a family chooses not to be part of our early intervention services, it is not mandated in any way, shape, or form. It is also provided free to our families, and by free we mean that our primary funding comes, our payer of first is Medicaid. So if the child is on Medicaid, then we are going to do Medicaid billing for early intervention services, which will not affect if they're receiving private PTOT, etc. Then we are going to utilize federal contract dollars through the Office of Special Education Programs. We do get a grant every year to help to provide those services. It's not much, but it's something. And then finally, our payer of last resort is state taxpayer dollars through the funding that comes in through the State Department of Ed, which is the majority of our funding comes from state taxpayer dollars. A lot of states do sliding scales or parent participation fees or bill private insurance. And Oklahoma at this time does not do that. That is not to mean that that won't happen in the future. It would just require legislative intervention to do that, to change the law. We are also a parent education-based program, which means that our primary learner is the child. It is never, or I'm sorry, our primary learner is the family member, not the child. And that is because we are coaching that family on strategies and interventions to utilize in when Sooner Start's not there. So we are looking for that carryover into routines. We're looking for that family member to utilize that information to help that child meet their developmental goal, with us being there on a weekly, biweekly, monthly basis, whatever that service delivery is, to help that parent through any struggles that they're having with that. We are also mandated to provide services in the natural environment. And by natural environment, that could be the child's home, that could be a child care center, and that could be where the child spends the majority of their time, which could be with grandma or with, Aunt Lucy or whoever that child's natural environment is. We are also family oriented. So when we write outcomes for our individualized family service plan, we are writing outcomes for anybody within that family who wants to reach a certain destination. I've written an outcome before for a mother who wanted to have her bachelor's degree finished by the next time we came through and did our annual review. So the only requirement for that is that whoever we're writing an outcome for has to be present at the IFSP. We cannot write one for dad doing more dishes if dad's not a part of that IFSP team. We are also routines based, which means that part of our development process of our IFSP is going in and looking at each individual routine of the family and fleshing out those routines. So tell me what happens during bath time. Tell me what concerns you have during bath time. What would you like to look differently? What's going good? Who's present? All of that information, and then pulling out those concerns from that routine and presenting them to the family as a potential outcome for them to decide if that's something they want to work on or not. Some things that we are not are required. I would say that with a little bit of a caveat. We are under Oklahoma law, or under federal law, actually, when a child is under a safety plan, also known as CAPTA, which means that they're in danger of being taken into foster care because of the environment they're in, and there's some kind of like unsubstantiated abuse, but enough that they've been put on a safety plan. Those children are required, or those are required referral to Sooner Start. So if DHS refers that family to Sooner Start because that child's under 3, we can't force that family to go through the process of Sooner Start. However, we are by law required to inform the caseworker that we've reached out and made contact and we have not either heard anything or we've been rejected. And the caseworker has the opportunity to tell the family to come back and finish the process. But that is on a complete different agency. We are not clinical or medical based. For the most part, when we say we operate within the natural environment, that is one of our compliance indicators that we report back to. And so we're not 100% on that. And I wouldn't expect that we would be. Because in some places, the only motor provider is a contractor that is seeing kids within their private practice, and that is a clinical based setting. Or a child is being seen at a health department, which is where most of our staff are located, because the provider is uncomfortable going into the home because there could be environmental reasons, like the home is infested with roaches or bed bugs, or the family member makes the provider feel uneasy. And we've got some pretty tough providers. It takes a lot for them to scare. So if it's something that they feel that they need to offer the family the opportunity to provide those services within the health department, then they have the autonomy to do that as well. We don't focus just on the child. We are not multidisciplinarian. We do not bring we don't do related services like the schools do, like so much OT, so much speech, so much PT, et cetera, et cetera. We have a primary service provider approach where that person is working directly with the family with a team of people behind them to support them, to help them, to provide consultation and recommendations that if providers need to move in and out of the IFSP, we can do that as well. Or have 2 providers on if that's a team decision, or 3 if that's a team decision as well. And we are not income based. You can make $0 a year. You can make $400 million a year. It does not matter. You will still qualify for Sooner Start services if your child is eligible. So looking at where we are, we're going to go forward through the Sooner Start process. And I'm just going to kind of give you a little high level flyover of what these look like. And then we'll dive deeper into transition, obviously, as we go through this process. So the first step in the process is for a referral to be made to Sooner Start, which can be made up until the child's 45 days before they turn 3 years old, because we have 45 calendar days to work that referral to completion. So anything less than that, then we're inside that that timeline that we would not be able to complete an IFSP. And so at that point, we would tell the parents about Child Find in the school system and direct them with those resources toward that, that portion of Child Find. So a referral can come in. And it can come in from anyone. It can come in from a parent, from a medical professional, from a daycare teacher, from Aunt Susie, you name it. It doesn't matter. Anyone can make a referral to Sooner Start. We do have to have basic information in order to go forward with that referral, which would include the child's name, date of birth, the parent's name, address, and contact information as far as phone number, so that we could reach out and start the process with the family members. So once that referral information comes in and we open up that file on EdPlan, then we're going to call that parent and start to flesh out that information. And that's called an intake. Grab my drink. So during intake, which can be done over the phone or it can be done in the family home, can be done at the health department, can pretty much happen in a variety of ways. We give that autonomy to our resource coordinators based on their schedule, the distance. Obviously, if we have someone who's in Clinton, we wouldn't expect them to drive, 2.5 hours to Eric, Oklahoma to complete an intake when it can just as well be done over the phone and better use of your time, energy, state taxpayer dollars, etc. So during the intake, we are going to gather information from that family, what their concerns are. We're going to look at some environmental factors in the home. We're going to ask about birth history. We're going to ask about some medical history, any kind of specialist they're seeing, et cetera, and kind of just get a better understanding of what that child looks like and what the concerns are. Based on that information that is given to the resource coordinator, they're going to make a suggestion to the family. So if you have a 27-month-old who is talking in 3- and 5-word utterances, in speech is the family's concern, then we're going to suggest that we do a screening. If you have a 27-month-old who has 2 words, period, then we're probably going to skip the screening and go directly to scheduling an evaluation. With that being said, any family has the right to request an evaluation. Even if we offer a screening, the family can say, nope, want a full evaluation, and the family is going to get a full evaluation. If we do a screening and it shows no concerns on that screening, but the family still wants to go forward with an evaluation, we're still going forward with an evaluation. So obviously that takes us into our next step, which is evaluation. For Sooner Start, we utilize the Battelle Developmental Inventory 2, the BDI-2, and it is a 2-person evaluation team with both people having to be from different disciplines. So you can't have a speech with a speech or an OT with an OT. It has to be someone from a different discipline. So we get together and we do that BDI. We also do a second test in the area of concern. So utilizing a speech concern again. If a family says, my concern is speech, then we can pull a separate testing to just look at that one area. So Those familiar with the BDI know it tests in all 5 domains. We would pull like an ELAP or a birth through 3 or a whole nother slew of stuff that we have in our operations manual and just do that speech concern. So during that evaluation, if that child has at least a 50% delay in one area or even a subdomain of that area, they qualify for services. If they have 25% delays in 2 separate domains, they qualify for services. If they have an auto qualifying condition, the evaluation is going to be part of the IFSP, and it's really about getting present levels of development. Then we don't have to do a quote unquote formalized evaluation. Also, our staff have the autonomy to do what's called informed clinical opinion on an evaluation. So if they're doing a BDI-2 and they have a child and they're looking at this testing, but based on their education and their years of experience, they know that this child could benefit from early intervention and the testing is not a good reflection of what that child can and can't do. You might have a parent that overreports. There could be a lot of different things, or just, sometimes the testing just doesn't pick up what we know in our heart of hearts is what we're seeing. And so they can write basically a narrative of why why they are deeming this child eligible, and that is located on the MEEGS as well. The MEEGS is like your MEEGS for the Part B people, and so when you get that file transfer, the MEEGS is what is going to have that narrative on it or how that child qualified, whether it's through evaluation through deficit, whether it's through informed clinical opinion, or whether it's an auto-qualifying condition. That auto-qualifying condition would be identified on that back page where the signatures are. So moving forward from evaluation, we've then staffed a provider, and then that entire IFSP team is going to go meet with that family, whether that's in the health department, in the home, McDonald's, you name it, we've met everywhere. And then we're going to write our individualized family service plan. And we're going to go through those routines. Like I said before, we're going to capture present levels of development that are going to pull from the evaluation. Unless it's an auto qualifier, then we're wrapping that all up in one visit. And then we're going to start to flesh out what those concerns are. We're going to present those concerns to the family. This is what you're telling me you're concerned about. What would you like for us to work on? They can pick one thing. They can pick all things. You might get an IFSP that has 2 outcomes that the family wants to work on. You might get an IFSP that has 20 outcomes that the family wants to work on. They are the ones who are driving this bus. You might have a child that qualified in speech, but you might get an IFSP that doesn't have 1 speech outcome on it because the family didn't identify that as a concern. And that happens. But that doesn't mean that our provider isn't in there working with that child's speech when they're working with that family. We are also going to talk about service delivery, how often that provider is going to come out. And that's really about a conversation and a decision that's made with the team at that time. Then part of the IFSP process is also talking about transition, and we will go deeper into what a transition plan looks like from the Sooner Start point of view. At any time, if you have any questions, just put them in the chat box. I'll be happy to address those. I meant to say that earlier. Unless you're watching this on a recording, then you can email them. So, how long does a child remain eligible for the Sooner Start Early Intervention Program? Well, we stop at 36 months. So the day they turn 3 is the day that they cease to be eligible for Sooner Start. And if they've done a transition plan is the day that they migrate over to Part B side. It can also be when a family no longer feels like the program is needed, and they can either feel like their child has met their goals and they don't have any concerns about their development anymore, or, even though we give all of this information to families about not being a medical program, about being a family program, that you're an active part of it, all of this conversation is happening along each of these steps in the process. The service provider gets in and, mom or dad or Aunt Sue leave the room to go, watch Dr. Phil or whatever he or she was going to do. And the provider's like, no, you're an active part of this. Come learn with me. And they're like, no, that's not what I signed up for. And so it could just be a complete not agreement of philosophy of how that should be approached. And so they can withdraw from the program at any time. Like I said, we are voluntary and they are free to leave. Or if a child is determined no longer eligible for Sooner Start services. So how this works is as that child gets closer and closer to their developmental age, where they should be on par with their typically developing peers, that service provider is going to have that conversation with the family and say, you know, little Timmy is doing so good. We had these concerns when he started. He only had 10 words. Now he's putting 2 and 3 words together. His articulation looks, sounds fantastic. I'm understanding about 75-85% of what he says. So, I'm not having any concerns as a service provider anymore. What are your thoughts? And that family member, hopefully we've established rapport and relationship with them and trust, and that family member is accepting of that conversation and says, you know what, I feel the same way. We're ready to go. We're ready to say bye. Thank you, Sooner Start, for doing your job. It's time to leave. Every once in a while, we have a family that feels like they would like to have another evaluation to show their child isn't delayed anymore, which is something that we would be required to do. So we're going to reevaluate that child in the same manner that we evaluated in the first time, with 2 separate disciplines together, same exact test. However, this time that child only has to show 125% delay in any subdomain, which could be the result of somebody not having a nap that day. I mean, I would probably score lower on that if I didn't have my nap. But so it's hard to reevaluate a child out unless they're just having a perfect day. We can have parents refuse to reevaluate and want to stay in. I will tell you that's never happened here, because then it kicks off a whole due process thing on our end, and nobody wants that. We want our parents to feel confident that when they're leaving, we're honestly ready to dismiss their child. We are not in the business of kicking kids out of services who need services. We are here because we know when we do early intervention at a young age, the impact is just tenfold as what happens down. It saves the state money. It saves that child frustration. So we are not going to ask a child or a family to reevaluate and leave if we know, in our professional opinion, they are not exactly where they need to be. We don't even do the 25%, honestly. They're usually right at developmental level or above when we're having these conversations, because we really want parents to feel good that their children are where they need to be. So let's do a deep dive into transition, the whole purpose of this WebEx. We are required under the Individuals with Disabilities Education Act, or IDEA, Part C, that every child that is within our program from the ages of 27 months to 33 months have a transition plan in place. And so usually at that 27 months is when we start this plan. We don't try to dance up to the edge or anything like that unless we have a hard time getting hold of parents, or we have a child that comes in later to that. And when we have children that come in after 33 months, it's called the late referral. And that's going to be one of the last things I wrap up with y'all. So between that 27 and 33rd month of age, that resource coordinator is going to come out with that service provider during a visit with the family. And they're going to start talking about what transition looks like. And sometimes it goes like this. Hey, we only go up to 36 months. What? Are y'all serious? Yeah, we really are. So we really need to talk about what comes next if your child still needs services when they turn 3 years old, because we don't want to just provide all of this great intervention and then this cliff to happen and then that child start to backtrack or not make any more progress. And so we go out there and we talk about what's going to come next. And this includes the family member, the resource coordinator, and the service provider or service providers. Also, this includes sending to the local education agencies or the school districts what's called a notification to LEA. The notification to LEA is required to be sent out to every single LEA regardless of whether that family gave consent or not. So we're talking about something completely different than the data transfer that we'll touch upon. The notification to LEA is strictly demographic information: child's name, date of birth, parent's name, contact information, their address, so that you know they actually live within your district. This goes out to the school districts, and it can actually go out as young as 24 months. Most people group them and send things at the same time. But that's going to go out, and what the school district chooses to do with that notification really is a process that is unique to each school district. Some school districts have a designated person that keeps track of all that stuff and tries to match data files that move over. But Sooner Start can't tell you what to do with that. That is just one of our compliance indicators. Notifications sent out to the school district. Check on every child between that age. So when we go out and we talk about transition, there's lots of options that we're laying on the table for the family, and they're unique to every family's community. So if you live in Oklahoma County, it's going to look completely different than if you live in McCurtain County. So we're going to talk about what school could look like, and that they could be eligible for services. We never go in as Sooner Start and say, hey, as soon as your kid's done with Sooner Start, guess what? They're getting services with the school. It's just not how we operate. We are there to tell them that there's an eligibility process with the school, just like there was an eligibility process with Sooner Start, and what that looks like, and that we can meet with the school and they can answer any questions that you may have and talk about their process as well. We can talk about Head Start, which may or may not be present in some communities out there, tribal Head Starts, which may or may not be present in some communities. We can talk about child guidance, which is located within the health department, which was kind of decimated with the budget cuts, but is starting to build its way up. And so since we are out there in the health departments, we have really good working relationships with the CDSs who provide child guidance. So that could be something that we hand off to them, tell them about. We can talk about child care programs within, if you have a child that's not in child care and maybe they'd benefit from being around typical peers, or preschool programs that are out there. We can talk about community services or things that are in the community, like private OT, speech, etc. All of those related services, giving parents a list of things that are within their community. We can also talk about specialized school. Of course, we have Oklahoma School for the Deaf and their satellite schools, as well as School for the Blind. In the bigger metro areas, we have specialized schools that address just children that have special needs. For those of you within Oklahoma County are familiar with special care, in Tulsa, they have like the little lighthouse. So there are things that are available that are unique to communities out there. And it's really about presenting all of this information to the parents, and the parents are the ones who make the decision on which direction they want to go in. So do they want to meet with the school and look at and consider eligibility there, or do they not want to meet with the school and they have private services that they're already receiving, and that's just going to be a continuation once they're done with Sooner Start? That it's completely up to that family on what they want to do. They might be wanting to do homeschool, or some kind of like virtual charter school, anything like that. It's really up to the family to decide, and us to offer a transition planning conference with whom the family wants to be there. So some of the options: parents can decline the TPC, the Transition Planning Conference meeting with the school district, or can decline to meet with any other community agency. They can agree to go forward with a transition planning conference with either a community agency or the school district, and then decline services after that happens. So we are just required to document what the family chooses to do. And we have a transition page within our IFSP that everything on that page has to do with transition. It has dates that are captured when we send the notification to LEA. It has dates that are captured that when we introduce transition to the family, what options we talked about, what the family decided to do. Did they give consent to send the file to the school? Did they decline to send the file to the school? Are we having a TPC with a community agency, such as a local Head Start? Are we having a TPC with the local education agency? All of those things are documented. When we have that TPC, we're also documenting things that are discussed during that transition planning conference as well. So that whole page is dedicated to documenting everything that we've talked about in each step of transition. So when we have a TPC that involves the school districts or the LEAs, it is Sooner Start staff responsibility to facilitate that meeting. And that is really because it is our compliance indicator whether it happens on time or not. So if we try to set up a TPC with the LEA because the parent wants them there and the LEA is unavailable during that time, we're still going to have that meeting. It's just going to be at home with the parent, and it's going to be documented that the LEA was invited but could not attend. And then the LEA will go forward with the information that we gather and give them that transfer of data, and they'll run forward with what happens next with evaluation and all of those different things. We also are going to, during that TPC, we're going to share information with the schools about what early intervention services are being provided. We can also talk about, what used to be provided if the child has a speech therapist now but had a child development specialist. All of this information we're going to give you, and that you'll have access to as well on the data files. We are going to encourage parents to share their concerns, share their fears, share what their child's strengths are, ask any questions that they may have, because a lot of these families, this is a whole new ball game for them. We have some that are repeat customers who come back and have been through everything before, but for a lot of parents, they've really just found out in a short amount of time that their child could even possibly be eligible to go to school at 3 years old. And so you have families that are dealing with new diagnosis or understanding that their child has a significant delay, and just really encouraging them to ask questions, to express their concerns, to advocate for their child. All of those things are, part of the things that we're helping foster in them. We're also going to encourage the LEA to share information such as what services could be available, what the next steps are going to be, contact information. This is what's going to happen, and we're meeting now, but I'm not going to contact you till next month. If you don't hear from me, here's my number, here's my email address. Please call me, let me know. So that the family has that contact. Now, they can always reach back out to their resource coordinator or their service provider, and they do, and say, I haven't heard anything from the schools. And we can say, oh, yeah, he doesn't turn 3 for, 3 months. You might not hear anything for a month. If you don't, let me know, and I'll reach out to my contact, or here's his or her information. Please reach out to them if you have concerns. So we're going to facilitate all of that and really start to present that family as a handoff to y'all and say, here they are, here's their concerns, and y'all are going to start to build that child and build that rapport with the family. So what our responsibilities are really to initiate that transition with that family, talk about what options, make sure that we're sending that notification to LEA for all of our children under the age of 33 months, and to transfer those records in Ed Plan if that family gives us consent. And then also to schedule and facilitate that transition planning conference. So all of that falls squarely in our laps and is our compliance indicator to meet on time. With 100%, I would like to add. So this is a little chart, and this is available in our transition brochure that we give each of our families so they're well aware of the timelines and what those look like. If you do not have this, it's available on our SDE website under Part C, and it's available as a document, or you can talk to your resource coordinator that you see quite frequently, and he or she would be happy to give you a copy of that if you don't have it, just so you know what we're giving parents. So everything that is in the blue is the responsibility of Sooner Start. So we are responsible for that initial transition planning meeting. We're responsible for that LEA notification and that TPC. And you can see that's where the school system starts to come in, and we walk side by side through that TPC with the school district having between the 33rd month up and including that child's third birthday to do evaluation, to determine eligibility, to have that IEP, and to have that IEP in effect on or before that child's third birthday. So the last thing that I want to cover is late referrals and what late referrals look like and what it means for us and what it means for you to a certain extent. So nobody likes late referrals. It's horrible when we get them. We know that it's going to put everybody in a bind, but they are what they are. If we get a child that is referred more than 45 days before their third birthday, but less than 90, we are required, that's the definition of a late referral under IDEA. We are still required to take that child's referral, to work that referral through evaluation IFSP, and to put an IFSP in place within that 45-day time period. It does not negate having a transition plan in place. It does, however, not require us to have a TPC. So if we got a child and they were deemed eligible at, like, let's say 89 days, that's going to be considered a late referral. Are we going to try to have a TPC with our school districts? Absolutely, because we're 3 months out and we can probably swing that and get that into place. If we have where we are writing an IFSP like 5 days before that child turns 3, are we going to have a transition planning conference? Heck no. We are going to send you that file and probably a box of chocolates because y'all are getting a late referral. And we're going to, that's just the way that's going to move. We still are going to send that LEA notification and referral to LEA no matter what the date, even if it's the day before. Now, I did talk to our data people because I've heard in the past that, well, we're going to get in trouble because you're giving us a late referral. We don't have time to work it, so it's going to go on our compliance indicator. Thank you very much, Sooner Start. According to our director of data for Part B, she states that with the proper documentation on both Sooner Start side and your side, in your contact logs, dates that are given, files shared, all of that stuff, there is a way to code that in your compliance indicators on the SDE side to not have that mess you up in compliance. So that really is about reaching out to data at SDE and saying, we got this child 3 days before he turned 3. We do not want to get dinged for this. There is no way we had enough time to do that. So late referrals are a headache for everybody involved. It's also sad that we're capturing a child so late in the process that we've really had little to no time to work with them as well. But however, by making sure and mandating that we are sending that file over no matter what, it does provide a shorter transition to that family so that they can start services with the school district, even if they've really gotten nothing from Sooner Start other than that evaluation. So I hope that makes sense. That's my part of it. I'll come back up in a little bit when we talk about data, and I'm going to turn it over to Destiny to talk about what Part B does.
Hi, everyone. So we are moving on to Part B requirements. And the first requirement is that children who qualify for special services will have an IEP in place by their third birthday. And that's indicated by, I want to say, indicator I don't want to make this up. Is it 12? It'll be 12. It's one of the indicators. We'll clarify in our data portion. And then another requirement is that the LEA is responsible for coordinating with the early intervention program, and that will be Sooner Start. Some common misconceptions, and these misconceptions we receive via email, phone calls, but they come from a various group of stakeholders. So it's not just teachers or school personnel. This could be from parents, advocates. So the first misconception is we don't have to take 3-year-olds, and LEAs are responsible. Is that feedback I'm hearing?
No, I think maybe.
The first misconception, so yes, schools do have to provide services for students who qualify for special services. They are mandated from the ages of 3 through 21, as long as they qualify, they are entitled to those services, and the school districts are mandated to provide those services. The second misconception is, but we don't have a 3-year-old program. Well, be creative with the way you meet the students' needs. Now, if you call up to the State Department, the guidance we give, since we are not a part of the IEP team and we have usually no knowledge of the student, we leave that up to the team in the school district to meet that 3-year-old's needs and designing that IEP to appropriately meet their needs. The third misconception is we don't have to test until they turn 3. That has to be done by the time they turn 3, and IEP has to be in place. So typically when our Sooner Start children, when they have that TPC and the LEA receives that, we can call it a geographic page, a notification to LEA, that typically is when the school district should start, that students shall be on the school district's radar. They should have a plan in place to have an IEP in place by the child's 3rd birthday if they qualify. And we will talk more about the evaluation and if students qualify and when they don't. So LEA is also required to fulfill child find duties. That child find duty is to locate, identify, and evaluate all students with disabilities who are suspected of having a disability. The students should range in ages 3 through 21. And the most important piece is that these students must reside within the LEA's attendance area. And that is a big concern from our LEAs, when students may reside with a family member or attend a Head Start or a child care center outside of the district. But if that student's legal address is within the LEA's attendance area, then that LEA is responsible for evaluating. Okay, furthermore, enrollment in the LEA. So our school districts know that the students must be enrolled in order for us to fulfill child find, because we need ed plan to do so. So the first thing is that students transitioning from Sooner Start will have an STN number unless they are a late referral. We also want to address, since we're talking about early childhood transition, students who are self-referred. Self-referred refers to families who have not received Sooner Start services. So those students are considered under regular child find. So for you 2 and 3-year-olds who are self-referred, who do not have an STN number, you need to enroll them. Your school registrar secretary codes them as PK3, and that PK3 is just to note, it's just for child find purposes, and that student isn't necessarily, that student is not enrolled, that student is not being counted on the attendance daily, and essentially they're not attending school, it's just child find. In order to proceed with child find, the school district must do a soft enrollment. The soft enrollment, typically, in order to fulfill that, you must have the child's first and last name, their date of birth, and their address, just typical surface information, so that the school district can softly enroll them in the student information system. And then from there, an STN will be populated. And we know that once that's done, we can proceed with on the ed plan side. Okay, and once that is done, the student is enrolled, and this goes for Sooner Start children specifically because you will have data. And in the event that it is a self-referred student, you may have an outside physician's report. So from there, you want to have your review of existing data meeting. LEAs, we call it our RED meeting for short. So that is where that transition group or the IEP team looks at the data. And yes, that data can, it's not just scaled scores and it's not formal testing. It's not just only formal testing. You can also include observation data, parent surveys, family surveys, additionally. And then from there, you need to schedule a MEEGS meeting. And MEEGS is short for Multidisciplinary Evaluation and Eligibility Group Summary. So after reviewing the REDs, well, after having the REDs meeting, excuse me, you then proceed with scheduling the MEEGS meeting. Okay, and Christi touched on this during the Sooner Start portion. Parents can decline at any point. They can decline testing, they can decline placement. In the event that parents do give consent to have their student evaluated, we know that a child under regular child fine, those that are not Sooner Start families or transitioning from Sooner Start, the school district has 45 school days to evaluate that student. Those school days include every day the school is in session. So it excludes our fall breaks, our Christmas breaks, our summer breaks. The only exception is our Sooner Start children who must have an IEP in place if they qualify on or before their on their third birthday. This is what the parent is giving consent to, a comprehensive evaluation. We want to stress that the evaluation must be comprehensive. So a sufficiently comprehensive evaluation identifies all of the students' special education needs, linked with a common disability or not. You just want to get an accurate picture of the student's full scope of needs as well as their strengths. If a student is found eligible after the comprehensive evaluation, then that data will translate to your present levels. And that's what you write and build that initial IEP on. In the event a student is found not eligible, it can happen. This information will assist the LEA in meeting that student's needs with appropriate instruction and supports. I want to encourage our LEAs to so with our Sooner Start children transitioning, Sooner Start is family oriented, and our LEA, when we have our IEPs, is individualized. That is what it is. So if a student does not qualify for school services after they've received Sooner Start services, just explain to the parents what general education intervention programs are in place to meet that student's needs. So that could be PBIS, that could be any tiered intervention that's available in the school district or at that school, after school tutoring, any additional help or resources that could help the student who did not qualify for for school age special services. So from there, during the comprehensive evaluation, enough data should be gathered that is comprehensive. It gives an accurate big picture of the student's needs as well as their strengths. In order to do this, we must stress that a qualified examiner must administer the evaluations used to determine if a student qualifies for special services or not. So we just want to clarify the school psychologists administer psychological and/or educational assessments. Our speech language pathologists are professionals qualified to assess for speech, language, and communication. And the same for our physical therapists and occupational therapists. They evaluate within their scope of practice. We wanted to add this to stress that screeners and evaluations administered by school personnel who are not qualified. I'll give an example. If you have a school personnel qualified to teach special ed or any other area, and they give maybe a RAT4 or some type of evaluation battery, and the team decides to use that to qualify a student, that teacher, although qualified to be a teacher, is not qualified to be the qualified examiner to determine if the student really does have special needs and whether they qualify or not. And then from there, once testing is complete, we have our MEEGS meeting. And from there, that is the meeting that determines whether the student qualifies for special services as well as related services. I've kind of touched on this already. The purpose of that meeting is to review and consider all evaluations. I want to add that just make sure there's enough data at that MEEGS meeting where there's not a doubt. It's clear cut whether a student qualifies or not. Typically, that will include more than one piece of data, more than one piece of just information. It's usually comprehensive. It should be very comprehensive. This is who attends that MEEGS meeting: the parent, the student if appropriate, the qualified examiner, the service providers, the special education teacher, the general education teacher, the administrator, and any person invited by the parent or any qualified examiner or any qualified professional who the team deems appropriate to attend that meeting. I do want to add that although a student may have never attended school or they haven't received services, there must be a general education teacher who's present at the meeting. School districts typically pull someone who has expertise in early childhood, and that's typically concentrated in your lower grades. And these are the 13 disability categories that our students qualify for. So if you skim through there or later when you read it, you see that DD is not here, but for our DD school districts, the suspected category will be one of these 13 categories. Then from there, we have our IEP, our Individualized Education Program. So if a student qualifies for special services, the law IDA gives that school district 30 calendar days to write that initial IEP. And school districts have different practices on how this is done. So some school districts will have the eligibility or that MEEGS meeting and then the initial IEP at the same time. Other school districts may take up the whole 30 calendar days, but by law, school districts do have 30 calendar days to write and implement that initial IEP. The only exception is for our children transitioning from Sooner Start. We know that an IEP must be in place by that child's third birthday, by or on that child's third birthday. So our IEP team identifies the unique needs of the child and ways to meet their needs. And the attendees at the IEP is the same as those at the MEEGS, with the exception of the qualified examiner. It is up to the IEP team to determine if it's appropriate or necessary for the qualified examiner to attend that IEP meeting, but essentially it's up to everyone on the IEP team. And then from there, the team must consider, not just the team, it should be documented in the IEP as well, of course, the strengths and the educational needs of the students, the results of the evaluation. I always encourage school districts, not just it's the guidance we give school districts, is to make sure that we are speaking in parent-friendly language when we are interpreting the data for our families. And it could be extremely overwhelming, numbers, testing, and paperwork, especially at that initial IEP. So just make sure parents have an understanding and an accurate picture of what their child needs help with and ways that the school district is going to meet that child's needs. Then from there, you all must consider the developmental, functional, and educational needs of the child. Parent concerns for enhancing the education of their child. We know that in the IEP, that box for parent concerns isn't very big. So just make sure that you capture their concerns. They can write it in the IEP. You can also attach any additional documentation in ed plan. We just want to make sure that in order to best serve that child, who sometimes we have no recollection of until they come up on a radar, just make sure you have the parent concerns so that they can give their view of their child, and we could take it into account, the LEA, in meeting that child's needs. And you also must consider the provision of FAPE. These are some other things the IEP must address. Special factors, our goals, progress towards goals, and our accommodations that we will provide the student to meet their goals. Additionally, if a student qualifies for related services, typically our children transitioning, our early childhood students who transition from Sooner Start or who are self-referred, there typically is a related service involved. So, of course, make sure that is included in the IEP, in addition to the service delivery and what that looks like and who will be responsible for delivering those related services. These are just some examples of least restrictive environment, just some options. And these options typically are dictated by the regions the school districts are situated in, just because there's access issues that we incur in Oklahoma. So district pre-K programs, private pre-K or kindergarten programs, childcare, Head Start. So if the team is considering general early childhood programs or regular education programs for a student, just make sure that a majority of the students in that program or placement are non-disabled. They must be non-disabled for it to be considered general early childhood. So I'll just specify a majority of the children for it to be considered a regular or general early childhood program must be non-disabled. And before I get to the data, I just want to go back to the biggie, which is on or before the third birthday. So when it comes to writing your IEP, if that student's birthday is in the summertime or falls on a weekend, or you just run into some timeline issues, make sure that on the services page, it is that child's third birthday. That is for reporting purposes. So although school may not be in session, you're unable to write that IEP and input the service delivery date before the child's third birthday. And even if school starts on August 1st and that child's birthday falls in the summer, just make sure for reporting purposes, it is the child's third birthday. And typically, if you explain it to parents that it's just for that reason, that is for reporting purposes, that this IEP is going to start on their third birthday because there are reporting issues if it's before, and afterwards it's reporting issues because it will negatively impact you all's data district profiles. So that is the biggie, and that leads us to data. And we are going to cover Part C data, which is similar to Part B as far as our indicators.
Okay, so some of this information, well, all of this information was provided by our data director, and it is important to note that both programs are required to collect and report on data. Our APR, our annual performance report for Part C, our indicator is number 8. And that is really all about transition. It's about timely transition planning. It's about timely notifications to the LEA and about timely TPC meetings. So all of that, like when I talked about TPCs falling squarely in the lap of Sooner Start, it's because that's our compliance indicator, where Part B's indicator comes into eligibility and IEP. Mm-hmm. And I'm sure, did you talk about like utilizing some of that they are able to utilize Sooner Start's evaluations if they want?
Yes, I will touch on that. So,
which can help with compliance.
It definitely can. So we leave it up to the school districts and the IEP team to determine how they proceed with Sooner Start's data. It's up to the team. So if the team feels like Sooner Start has sufficient and a comprehensive picture of the student as far as data and any observation notes, those types of things, the team can determine that this child qualifies, and we do not need to gain parent consent to administer any additional evaluations. So it's completely up to the IEP team to determine that. So we're not mandating that once you get an early childhood student that you have to administer any additional evaluations. It's up to the IEP team.
You can. You don't have to. You can. That's really a district decision and a team decision. So one of the things that we wanted to talk about with our exiting files with transition is that one of the things our data team wanted to talk about is not deleting any of those student history events, especially the transference of the file, because that does create a history event on Part C and Part B. And there were some school districts who are going in and deleting that event happened, that transfer of records happened for whatever reason. And we don't know what we don't know until we know it. So we're just doing a friendly reminder not to do that, because that really is about how our data team captures what happens to our Part C people by following that student testing number into Part B and seeing if that child had a development of an IFSP. There are ways they do that, and one of those is having that history in place. As fortunate as we are to be the only state currently that has a data system that is shared, there are still flaws in it, which means that there's not data that automatically says, hey, data team, this person was a Sooner Start child. Now they have an IEP, so they have to go look for that. So we want to make it as easy as possible, because we love our data people and they make our lives easier. And they're not even watching. So, with Part C, a lot of this I touched on before. We are going to document everything. All of that transition preparedness is going to be captured on that transition page, unless it is a late referral. Everything's going to happen 90 days prior unless it's a late referral. So one of the things that we did find out in doing this training is, one of the things I knew before is when we transfer that file from Part C to Part B, that file's stagnant. As we update it on Sooner Start side, it doesn't get updated on your side. However, some things can happen. Like we can have a new evaluation process. We could have a new IFSP written. We could have hearing or vision results that get updated. There's like a plethora of things that could happen. We could send you a file of a child that's a late referral, and then the next week we have an STN, but when you got the file, there was no STN. My suggestion to you, especially in the case where there's no STN, is to reach out to that resource coordinator and say, hey, has an STN been generated? If so, can you email me that? Because what's going to happen if you start working on that child in the workspace and you ask the Sooner Start to reshare that file, which we absolutely can, it will wipe out everything that's within your workspace, which makes people unhappy, because doing work and then having to do work again, nobody likes doing that except Destiny.
No,
she loves to do that now. So just reaching out to your RC and saying, hey, do you have the STN, or reaching out to the regional coordinator within your region, and trying to capture that information. If a parent has given us consent to share, that consent remains in effect until A, the child turns 3, or B, the parent revokes it. And if the parent revokes it, we're going to tell you they've revoked consent. You can stop what you're doing now. So that's important to share that information as well.
As in regards to Part B data, districts must track occurrence and timeliness. And timeliness is the big word. And I would communicate that to parents, especially if their children's birthday falls in those summer months, as to why that service date is their third birthday. Is for reporting purposes. And that's the way to report that we timely transition this student from Sooner Start to Part B. We've touched on screening does not count as an eligibility determination, hence the purpose of a qualified examiner and a comprehensive evaluation. And everything must happen prior to the child's third birthday. We cannot stress that enough, because indicated 12, we must be in 100% compliance. There's no room for error. So that is why it's so important to transition our students in a timely manner. And then, of course, report timeliness for every referred child and reason for delay. That is why we are, as far as Part B, we're not dinged for late referrals. It's because you all get to actually get to explain the reason for the delay, and our data team codes it as such so that it reflects accurately on Part B. Okay, in addition, we did leave some transition practices for you all to read through and reflect, and you can measure how well you're doing with these transition practices. We're not going to go through one by one.
No, and we're going to send all of
Yes.
this information to everybody who registered and everybody who attended in person is all going to get the PowerPoint, like I
Yes.
said before, as well as a compiled list of questions that have been asked and answered throughout this whole entire process.
Yes. We are going to leave you with some resources. So the big one is the second bullet point. Sooner Start and Part B have worked very hard on our transition one-pagers for families in schools. It covers the same information. The wording is differently, so that is parent-friendly. And this should be a great resource for anyone new to the team that you may not have much knowledge with early childhood transition.
So when you get these, obviously the hyperlinks are active and you'll be able to click on those and navigate directly to where Destiny put those amazing resources. Finally, we're going to leave you with our contact information. So if you want to take a brief moment to capture that, take a picture of it. Of course, if you have any questions on Sooner Start side, I would be happy to help you, as well as Destiny on the Part B side. Tristan Bratcher is one of our data specialists. Travis Thompson is the other. So that information is there. We really are tasked from the head up, from superintendent all down, to have good customer service and to provide good technical assistance to not only our own employees, but our school districts that we serve as well. We are here to answer the questions, and it is not a burden and it is not an inconvenience. It is something that is part of our job. And so, because when we do this successfully, what we do is we create amazing, smooth transitions for our families, which is what our job is they're coming from our program into your program. And we want to make sure that everybody is on the same page and that these families are getting seamless services for their children that are exhibiting some pretty significant delays, and they're already, tackling those issues. And we want to make everything on the education side to just be smooth as silk.
Perfect.
Yeah. Does anybody have any questions for us? We have the chat box. Feel free to, shoot us a couple of questions if we've answered everything. It's only because we've done this 9 times now. But and if you think of something later that we haven't covered, please give us a call or shoot us an email and we would be happy to assist you. Okay, so in the meantime, thank you very much for your time, and for those of you who showed up for the second time, blessings.
Thank you so much.
So yay that we did it without any tech issues this time. Y'all have an amazing afternoon, and thank you again.